Hello, my friends. Hello, hello, hello. We are going live for our National IC Support Group meeting, and let us see what's what. That's important. This is important. This is important. Here we go. Oh, crap. I did the wrong one on Facebook. Hello. Hi there. Let's try this again. Hi, YouTube. How are you? How's life treating you today? Hold on. I screwed up Facebook. Okay, use camera, FaceTime. There you go. We're going to switch that microphone. Yes, we are. All right, live IC and pelvic pain support group meeting. Hi, you guys. Let's see. I'm just setting up Facebook because I set it up on the wrong stream. So hold on one sec. Right. Let's see. Let's see. Hold on. Meeting now. All righty then. Hi, you guys. Hi, Deb. How are you? All right, let's get this. I got to make sure that I got to turn that Wi-Fi off so that we are. Setting up these two streams at the same time is never easy. Let's turn that Wi-Fi off. So you are hardwired. You are hardwired. No, there shouldn't. Okay. Dear gods. Okay. And now I know that's all set up. Now we got the right equipment. All right. Woo! All right. Let's let Facebook get started. How are you, Deb? How's life? I would tell you, I had a flare I had a flare. I had a 2-day pelvic floor flare, and it was not good. My pelvic floor was spasming like nobody's business. Hi, Donna. Donna says 1 more week and I'll be back in Virginia. Good. Oh, girl, good. I want you to get home safe and sound, right? Hi, Facebook. We're trying to get Facebook turned on. There you go. All right. Hi, Facebook. Hello, you guys. I hope you're having a good day today. Let me introduce myself. My name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. It is Sunday, August 22nd. I cannot believe it's going to be September in a week. Like, holy moly, has time gone by quickly. Here in California, although because we have drought too, all of our trees are already turning orange. So my Japanese maple out front is turning orange, but it might also just be water. But even in the distance, you can see it. I'm ready for fall. I am ready for fall. Hi, Facebook. How you guys? How are you? I hope life is treating you well today. So my name is Jill Osborne, president and founder of the Interstitial Cystitis Network, longest serving IC support group leader in the United States at 28 years. My purpose in doing these meetings is to educate you, is to empower you, is to give you new information that you may not be aware of. It is to perhaps open a few doors for you if you're finding that you're not getting better with the treatments that you're doing. I want you to know, like seriously, the single most important thing you need to remember from this meeting, and I'm looking at you right now. You are not alone. You are not in this alone. We are here. We are together. You have millions of brothers and sisters with IC, and we are long past the days of saying that this is emotional, this is hysterical, that you're damaged goods. That's a load of crap. You're no different than somebody who's been hit by a car. You're hurt. And our job is to try to figure out why you're hurt, what's going on, and trying to make you better. And we really have to shed. I got to tell you, man, I was working with a patient this week, just a couple days ago, who again, she has COVID cystitis, which is something I have to talk to you guys about. She has COVID cystitis, and her doctor had the audacity to tell her it was all in her head. 11 months she's been suffering with a flare after getting a COVID infection. Now we know why. And so this is what we're starting off this meeting as. And normally when I do these meetings, I do about a 30-minute little lecture, presentation, whatever, my little thing. And then I will take your questions. And I'm happy to take any and all of your questions. All right, that's not a problem. We might go on to Zoom. We might not. We'll see. We didn't do it last week. Here we go. So this is what we've known from day one with COVID, 18 months of COVID, is that some patients who get COVID go into flares. And these are not typical flares. These are flares that don't respond to therapies well. These are flares that can be agonizing. These are flares that are puzzling because they don't respond to traditional therapies. And like many of you, you've gone to your doctor, you've asked for help. Your doctor's like, I don't know. I've never worked with any other patient who has had a flare after COVID, which is what happened to this woman that I was working with on Thursday or Friday. Now we know. Here it is. COVID-19 inflammation results in urine cytokine elevation and causes COVID-associated cystitis. Done by the top research center in the United States for interstitial cystitis. This is Beaumont Health in Royal Oak, Michigan. The researchers include Michael Chancellor, who many of you should recognize as absolutely one of the top tier IC researchers in the world, as well as Laura Lamb and a few others. Okay. So the new name for this is COVID-associated cystitis. COVID-associated cystitis. And we have talked about this in previous meetings because remember, the IC network, we have been doing the only IC COVID study through our website. And what our website showed, what our survey showed, is that some patients were entering severe flares after getting COVID. And the question is why? Why is that happening? Now, theory number one is that the COVID virus is actually in the bladder wall. Now, we know people get viral infections in the bladder. We have known that. There's no doubt about that. It can be an HPV, it can be polyoma, it could be herpes, it could be other viruses, right? And so kind of theory number one that I remember when we started getting our results, I was talking with several other IC researchers going, why do you think this flare is happening? Could it be a viral infection? And the answer is, yeah. I mean, we've got research that shows that you can get we have research that shows that they found active COVID virus in kidneys, like 4 studies, 12 studies that have found active COVID virus in urine. So it's not a stretch. It's not a stretch to think that, in fact, some patients could get a COVID infection in their bladder wall. I would assume, especially if they have open wounds in their bladder, like Hunner's lesions. I think that, it's like an open door for infection. But what these guys did is they started studying the urine of patients with COVID. And what they found was massive inflammation. It's called, as demonstrated by an increase in cytokines. And cytokines are one of the messengers in the inflammatory process, for lack of a better term. And so I just wanted to read this to you. COVID-19 can also result in unexpected symptoms, including, as we know, loss of taste, smell, small itchy lesions on hands and feet, swollen eyelids, increase in eye discharge, GI symptoms. However, Mom and colleagues reported an increase in urinary frequency in COVID-19 patients, and we also confirmed that COVID-19 patients develop de novo severe genitourinary symptoms, most notably urinary frequency of greater than 13 episodes in a 24-hour period and nighttime urination. Now, when they say de novo, what they mean is that this patient, these are brand new symptoms to this patient. This patient has no history of urinary issues for them. This is a brand new symptom for them. And of course, this is not an IC study. This is just in the general population. So again, what they found is that some patients are developing severe genitourinary symptoms, most notably urinary frequency greater than 13 episodes in 24 hours. 13 needs to use the restroom in 24 hours, and greater than 4 episodes at night, or having to get up. So we hypothesize that COVID-acquired cystitis with the presentation of de novo severe urinary symptoms can occur in COVID-19 patients and is caused by increased inflammatory cytokines that are released into the urine and or expressed in the bladder. We further hypothesize that chronic COVID-associated cystitis may occur in COVID-19 patients who do not fully recover and have a chronic inflammatory condition ongoing. In other words, another presentation of long-haul COVID, chronic inflammation. Let's see what else here. So what they do is they go through the history of viral infections in the urinary tract. We know that HIV can create lower urinary tract symptoms. HTLV, which is human T-cell lymphotrophic virus, can cause urinary symptoms. Polyoma BK, megalovirus, and adenovirus, right? So we have a long history of understanding that. They also directly bring in and mention interstitial cystitis, because what they say that in some interstitial cystitis, we certainly know that there can be an increase in cytokines in urine, which describes an inflammatory reaction. So let's see what else. We don't need to. A lot of this is very academic. I've talked about this before. Pro-inflammatory mediators, including cytokines, can damage and irritate the bladder wall and the bladder tissue that is in contact with urine. The bladder mucosa is a dynamic sensory structure that can sense bladder fullness and can modulate bladder nerve and muscle function. Inflammation damage to the mucosa can thus result in bothersome lower urinary tract symptoms, as the damaged urothelium may activate afferent nerves as well as locally influence bladder muscle function. And they say infection with SARS-CoV-2 in some can result in systemic inflammation and abnormally high an abnormally high immunologic response that is associated with more severe COVID-19 symptoms. This has been referred to as the cytokine storm syndrome or cytokine release syndrome. Yada, yada, yada. In our observations, we have observed that several cytokines are elevated and detectable in urine of COVID-19 patients. The presence of these cytokines in urine could impact bladder sensation and thus function, resulting in the observed increase in urinary frequency and nocturia. It is also possible that the virus may directly damage the bladder tissue, impacting bladder function. Lastly, impaired kidney function may also cause some of the symptoms associated with COVID-acquired cystitis. If our hypothesis is correct, we predict that drugs that are useful in helping overactive bladder may also be considered for CAC. Given that rest and sleep are important during illness for recovery, Improving nocturia and frequency could help improve the speed and quality of recovery. Further, monitoring urinary cytokines may serve as a prognostic indicator for COVID-19 progression and severity. All right. So anyway, this doesn't come as this does not come as a surprise, because we've known this. We've known that some patients were flaring. It is great to have a name. We have a name, COVID-associated cystitis. I will be building a website on this so that we have it. The question now is, what do we do to treat it? And I have got feelers out to most of the top IC researchers out there, asking for their feedback on this. One doctor, Rob Moldwin's clinic, they weren't seeing long-term flares, because they let me know when I put out a tweet over the weekend, on Friday, that they weren't seeing long-term flares with IC patients. So they are somewhat disagreeing with us. However, the team up at Beaumont certainly is seeing flares, and we are certainly seeing flares. So I don't have a protocol for those patients. I don't. I wish I did. I don't. I think what you've got to do at this point in time is do everything you can to reduce inflammation. And that means rest as much as you can, eat as well as you can, lose the sugar, lose the junk food, anything that can cause an inflammatory response in the body. Getting back to this patient that I was working with on Friday, her doctor said, well, we could do a hydrodistension. He didn't believe in COVID cystitis. And that made no sense to me. Why would we stretch the bladder and potentially cause more inflammation? And so I'm having her give her doctor this new paper. And there are, how many papers now published? There are references here, 17 references. And it was first May 2020 is the first paper on this in the European Urology Journal. Urinary frequency is a possible overlooked symptom in COVID. You got to follow the diet. You got to protect your bladder. And as soon as I have more, I will tell you more. Dr. Theo Harides, who is a top-tier IC researcher at Tufts University. He is the gentleman who invented CystoProtect. He is the kind of king of kings when it comes to pharmacology. He did give me a protocol of using some supplements, his supplements, but it's very preliminary and tentative. And again, I'm asking every doctor I can to give me feedback on what you should be doing in this situation. We're probably going to be doing another survey also. Let me pull up his email really quick here. Hold on again. So what he is recommending, and let me see here. So I'll read my email to him, and I will read you his response. Yet another tragic phone call from an IC patient in a severe month-long flare after getting COVID. What do you think is driving this? Neuroinflammation or active viral infection in the bladder wall? I'll take any suggestions you have, as you are the only researcher I know studying this. And of course, now we know that there are more. We didn't know this when I sent this email out in June. I suggested the arginine depletion study in case you were taking any supplements with arginine. Using lysine to interrupt the viral replication cycle makes sense. We need to give these patients some hope, and more importantly, some practical tips that might help. And his answer back is inflammation, that he thinks it's all being driven by inflammation. And he was recommending 2 soft gels of CystoProtect twice a day, 1 soft gel of FibroProtect twice a day, vitamin 3, 10,000 IU per day, Zyrtec 10 milligrams once per day, Pepsid 20 milligrams once per day. And so that was his protocol. And I will publish this. I will have a blog on our website soon in the next 48 hours that will go over all of this. So anyway, and then I've also asked Natural Approach Nutrition if they could come up with a protocol too, potentially, because this is brand new for everybody. This is brand new for everybody, guys. Everybody at this point in time is just putting their heads together and just brainstorming and trying to think about what could possibly help patients who are in COVID cystitis flares. And so it's going to be very dynamic. It's going to be very hit or miss. Don't assume that anybody has the answer, because I will tell you, nobody has the answer right now. We're at this point in time just brainstorming, trying to get you out of a flare for those of you who are in flares. Now, this does bring up yet another important topic, and that is vaccine reactions. So some of you are deeply concerned about vaccine reactions. And I will tell you that in our work that we're doing, and the work that I've been doing for the last year and a half with COVID patients, my guess is that 90% of IC patients who have the vaccine are fine. No problems. I had the Pfizer, no problems at all. I think 5 to 10% of IC patients who have the vaccine might have a flare for a couple of weeks. I don't know why. None of us understand it, but enough of you have reported flares that is real. But you have to understand the risk versus the benefits of the vaccine is compared to the risks versus the benefits of active COVID infection, especially the Delta variant. This is a deadly virus. And so, as an example, with COVID-associated cystitis, you run the risk of potentially having a severe flare for 9, 10, 11 months. Whereas with the vaccine, you might have a little flare for a couple of weeks. I encourage you to talk to your doctors. You need to talk to everybody about it. Please don't believe all the hype online that are poo-pooing the vaccines and discrediting the vaccines. Pfizer should be approved, FDA approved as a vaccine tomorrow. But we're trying to save lives now. And there's nothing more heartbreaking than you've got one person in the household who's immune deficient. God forbid you live in the South and your kids are going to school and they're not wearing masks and they're bringing it back. I was working with another patient who was just terrified. So please protect yourself. Wear a mask whenever you can. I right now am back to double masking when I go to the store because I got Delta variant in my freaking neighborhood. It's at my schools, the schools that I went to. I can't believe it. So now when I'm going out, I'm double masking. I have a cotton knit mask and then I have a cotton broadcloth mask. And it's perfectly fine. There's no problems breathing at all. None. And then the other thing that I think is really, really important is to wear glasses. And if you don't have, wear your sunglasses in the store. Wear safety goggles in the store. Because what the research shows is that you can get COVID infection through your eyes. But if you're wearing glasses, that reduces your risk of infection by about 80%. 80%, according to the last study that I looked on that. So double mask, wear glasses when you're in crowds. And I think that that's the best we can do. We are in God's hands at this point in time. Oh, it's crazy. What a crazy life. Kind of depressing too. Like, seriously. I mean, I'm normally really optimistic about stuff, but the last couple of days have been hard. I think they've been hard for everybody for a lot of different reasons. Okay, so that's my scoop. If for anybody who has COVID-associated cystitis, please reach out to me. My email address is icnetwork@mac.com, icnetwork@mac.com. I will put you on a special mailing list. And as soon as I get any more information, I will absolutely get that out, because I know that you're suffering and I know that you're scared, and we're going to try to make this better for you. Okay. All right. Now let's get into your questions. Arlene here. So we're simulcasting. If I'm looking here, I'm looking at YouTube. If I'm looking up here, I'm looking at Facebook. If I'm looking over there, it's because I'm looking at Facebook messages. So hold on a sec, because you're on a different computer. All righty then. Okay, so hello, Sylvian. Hello, Crescenda, Christy, Corrine from Belgium. Nice to see you, Corrine. Big giant hug. Anne says, you're in an IC flare. Any tips on what you should drink? Yes. If Of course, we have to understand what kind of flare you're having. Are you having a bladder wall flare or a pelvic floor flare? They're different. You get a bladder wall flare from eating or drinking the wrong thing, or when your hormones have changed. In comparison to if you get a flare from sex or riding in a car, they're completely different beasts. So if you're having a bladder wall flare, we're going to be doing things that are going to calm and soothe your bladder wall. So normally what you would do is drink water. Let's dilute your urine, 1 or 2. Number 2, we want to alkalinize your urine, maybe with some pre-leaf or some Pepsid. I'm sorry, not Pepsid, Tums, pre-leaf, Tums, or even a quarter teaspoon of baking soda in a glass of water. Then we want to try to numb your bladder wall with some over-the-counter azo. That might be helpful. And in terms of what you can drink for a bladder-induced flare, you're going to go with a peppermint herbal tea or chamomile herbal tea. Why? Because they're smooth muscle relaxants. They've been proven in research to relax the smooth muscle of the bowel. So if you're going to ever have a colonoscopy, well, the best thing you could do is drink a strong cup of mint tea beforehand. They have proven that will reduce any spasms you might have after during or after colonoscopy. So we think that same thing's happening in the smooth muscle of the bladder. So I would be drinking peppermint herbal tea, chamomile herbal tea. You might be able to get away with rooibos herbal tea, but that's it. Water, that's it. Lisa here on YouTube says, are we immunocompromised with IC? The answer is generally no. Of course, we have subtypes, right? So we've got our 5 foundational subtypes: Hunner's lesions, bladder wall driven, pelvic floor driven, pudendal neuralgia, and central sensitization. There is a small group of patients who do share some autoimmune diseases like Sjogren's syndrome or lupus. So if you're an ICer who has Sjogren's or lupus, then yes, you might be a bit immune compromised. Hi, Andrew. Hello, Tony. Valerie says, new cystitis confirmed with COVID. It means that people who get COVID are ending up with very, very severe flares, very, very severe flares. And they're calling it COVID-associated cystitis. And it's due to inflammation. We think it's massive inflammation in the bladder wall and or active viral infection in the bladder wall. Anne says, does a regular cystoscopy show Hunner's lesions? The answer is no, unless it's a narrowband imaging cysto. There's a very specific type of cystoscopy called narrowband imaging that will identify Hunner's lesions. But the problem is very few clinics use it or have it because it's quite expensive. Hi, Kristen. Hi, Frida. Hello, Debbie. Hello, Mary Crow. Hello, Rada. Anne says, IC flare, what tips can you suggest? It's been a week already. So again, Anne, it's about the type of flare you're having. If you can tell us what you're having, what triggered your flare? Do you have any idea what triggered your flare? That'll help us figure out what the right protocol is. Gina says, are you saying COVID infects the bladder? Yes, we do believe that COVID can infect the bladder in some patients. Yes. We've been knowing that for about a year now. It's either, as they just said in this journal article, it's either a massive inflammatory cytokine storm or that COVID itself is infecting the bladder. Okay. And again, we know that because we've already had research that have found live COVID in urine. So it's not that big of a stretch. Hi, Barbara. Nice to see you, hon. Okay. Let's see. Cindy said, oh, here, hold on a sec. Rada said they were severe and all over my something were severe. I guess your Hunner's lesions were severe all over my bladder. My first cysto was in the office and I saw them on the screen. Wow. Cindy said, my body is nerve flipping today. You know what? Oh my God, you guys, mine did too. I don't know what the hell was happening on Friday, but man, my nervous system was so freaking sensitive. It was surreal. I could smell everything. Any weird thing in my house, I could smell. And I made the mistake of, I get imperfect foods deliveries, which is normally veggies and fruits, organic stuff like that. And I really like them, but I ended up getting a frozen chicken marsala for my parents. And I'm like in my kitchen making my mom salad going, what is this? Oh my God, this is awful. I was cooking in the microwave. It smelled like rotten fish. And I could have passed out, because those of us with IC subtype 5 central sensitization, we have a really wicked sense of smell, and smells really hurt us. And I was just trying to figure out where this bad smell was coming from, and then I picked up the wrapper and just like, oh my God. And then I opened up the microwave. It's like, oh my God. And I literally ran. What did I do? I put it, I ran all the packaging outside and I put everything down the drain. Friday night was not a good night in my house because we had that. So our dinner was destroyed. Then my dad burned the rice. And then I overcooked the broccoli and that stunk like hell. And the only thing that worked Friday was I made apple crisp. And so we had dinner for we had dessert for dinner on Friday night. It was hysterical. Sometimes that just happens. Things are better now. Things are better for me. My nervous system is definitely calmer now than it was then. Nicole says, what's the best urologist or urology clinic in Florida that you could recommend? Nicole, if you can hang out towards the end of the meeting, I'll pull up our Harvard database of IC providers and pelvic pain providers, and we'll look it up. We just don't do it at the beginning part of the meeting. I want to get through your questions first. Hi, Rhonda. Rhonda says, just got over a bladder infection, still feeling bladder pressure. Remember that the bladder is the slowest healing organ in the body. It's going to take several weeks for your bladder to calm down once the infection is gone. So you need to follow the diet, protect your bladder, do things that are calming and soothing, like peppermint tea, chamomile tea, and you might even want to consider one of the supplements that might be calming and soothing, like Allopath, like, Bladder Builder, Bladder Rest, Sister Protect, something like that. Christy said she had a bad reaction to tap water. Sorry to hear that. Cindy says, my ears were ringing yesterday. Oh, my ears ring all the time. Crescendo asked a good question. They say, if you're a vaccinated person with IC, should you go ahead with the third shot? I have no clue. I mean, here in California, they're only making it available to people who are transplant, who are either cancer patients or they've had a transplant or they have some sort of other critical immune issue. Otherwise, for the rest of us, it's not available as a third shot yet. I don't know. I honestly don't know. For anybody who does have a third shot, please let me know how you're doing. Corrine says, I had COVID in March 2020, very sick, still not okay. 5 months at home, so sick, getting nuts, had Botox. Veronica said, God, you guys, so many of you are having flares, darn it. Lorraine says, we recently observed patients documented COVID developed de novo severe genitourinary symptoms. Right. Thank you, Lorraine, for copying that. Much appreciated. Kathy says, do I have the website on the info that's talking about it? Kathy, it's a journal article. You can see it on the National Library of Medicine. If you go to PubMed.gov and type in COVID-associated cystitis, that will pull up all the research studies for you. Jacqueline on YouTube says, I found out that I can't have quercetin. I'm now going to try doing all the other ingredients in the supplements minus the quercetin to see if it will help. Interesting. The challenge with quercetin is a lot of quercetin is derived from citrus, and it can be irritating. You want the quercetin that's derived from the Sephora plant. Arlene says people in Florida are going in for third shots with no question. Well, yeah, man, in Florida, absolutely. Nicole says, thank you for taking the time to do these live chats. You provided me with crucial information and was getting diagnosed correctly. Thank you, Nicole. I'm happy to help, hon. You guys, I'm not doctors. I can't give you medical advice, but my job is to educate you, empower you, give you options, and kick you in the butt and get you back to the doctor with different questions, right? And also, Kathy, I will be building a new website on COVID cystitis. I already have the domain name. It's covidcystitis.org. It's just not built yet. I wasn't feeling too well yesterday. My legs were really hurting from my ruptured disc in my back. Christy says you downloaded the papers with the foods you can eat and not eat. Thank you. It opened up more food options. Exactly. Yeah. So again, guys, remember, when you're food sensitive, it really points us to your bladder wall. It's the source of the problem. And if you had an open wound on your hand, would you pour coffee on it? And the answer is no. And the same is true with the bladder. The bladder is vulnerable just like any other part of the body. The bladder can be injured just like any other part of the body. And when it is injured from chemicals or trauma of some type or UTI or whatever, it is going to be more vulnerable to foods. And that is why following the diet makes sense. We want to create an environment that will support healing. If I had, let's just say I fell and skinned my palm, right? What do you think would happen if I poured acid on that every single day? If I poured a cup of coffee on an open wound every single day, what do you think would happen? Well, I tell you what would happen. It would get redder and redder and redder and bigger and bigger and bigger because the acid would be eroding the wound. The same thing happens in the bladder. The same thing happens in the bladder. If you have a wound in the bladder and you put acid on it, it's going to hurt like hell. Thus, your very first job is to create an environment that will support healing. There is going to come a time when you will be able perhaps to enjoy some of those again. But if you are in the middle of an active bladder wall flare, you would be foolish to drink coffee or soda. It will only make it worse. We have to calm things down. We've got to give those tissues time to heal. The problem, of course, is that the bladder is the slowest healing organ in the body. It takes 2 weeks for one cell to be replaced. Nothing happens overnight. Nothing. It's impossible. It's physically impossible. You cannot follow the diet for a week and expect that you're going to have a response to that. It will not work. It takes 2 weeks for one cell to be replaced. Rhonda says, I need that list. Honey, it's over on our website, icnetwork.org. icnetwork.org. Christy said, I had the Moderna and I didn't have a flare. Awesome. Good to hear that. Marie says there's an IC food list app that has saved me. Yeah, that's my app. I built that. We built that. It's out, sadly, behind in terms of programming. We've been working on another app. And so the food app will probably be updated next year. The challenge with the apps is, they break even barely. It costs $10,000 to update an app. And for the latest app, we put in $25,000 so far. And, we'd like to be able to, in some way, get that money back. But it's hard. Apps are kind of a lose-lose game right now. Jody says, would you recommend the third vaccine? Again, I don't know. Cindy said, let's see. Lorraine, thank you for the 99 stars. I so much appreciate that. Okay, Cindy's having a pelvic floor flare. So what do we do with a pelvic floor flare? Number one, we have to relax the muscle. So Cindy, the very first thing you would normally do is grab a heating pad and you got to put it over your belly. And I have a great, where's my heating pad? Where's my demo? Here it is. Okay. Look at this beast. You want to talk heating pads for the pelvis? This is the heating pad of heating pads. And this is a microwavable heating pad. You heat it up for anywhere from 2 to 3 minutes, depending upon the strength of your microwave. And so normally what you would do is you would just put this right over your pelvis like this, right? So our goal number one is to start to take the stress and pressure and tension off of those muscles. So put your feet up, sit in a recliner, use your heating pad. Then we want to do something, you might want to consider something like a muscle relaxant, like a vaginal Valium suppository or a Flexeril or Baclofen that you can take orally. And of course, even before using that, you would be using your wand, which I had to use 3 days in a row because I had a freaking pelvic floor spasm. So number one, relax the muscles. Number two, use your wand to get in there and relax those muscles. You know, the challenge with the pelvic floor muscles is that they lift off the bone. Normally, the pelvic floor muscles lay right on top of the bone. But what happens is when they get tight, they lift and they start interfering with the bladder and other organs. And so when you're using your glass wand, really what you're doing is we're just trying to get these muscles to release and to flatten again. And so using a glass wand like this, invaluable, because you can do it at home. You just have to be taught how to do it. And then thirdly, using medication, again, like a vaginal Valium suppository, maybe medical marijuana, something like that. And if the flare doesn't resolve after, you know, a couple of days, like mine's definitely better today, but I can still feel it. For me, it feels like, what does it feel like right now? It feels like there's a hand in my vagina that's trying to pull stuff out of me, except it's not pulling right now, but I can still feel it. That's how I feel a pelvic floor spasm. And so it's all about getting back to that physical therapist and reworking with those muscles and getting those muscles healthy again. Jamie says she takes Elmeron for flare-ups. Honey, Elmeron doesn't work that way. Elmeron is not a flare drug at all. What Elmeron does over time is it slowly coats the bladder, but Elmeron has a lot of problems now because it's now associated with retinal eye disease. Elmeron has never been in any protocols for treating urgent flares. Rather, what they would do for a bladder wall flare is, number one, dilute your urine. Number two, alkalinize your urine with some pre-leaf or some a Tums, or again, a little bit of baking soda and a little bit of baking soda and a glass of water, like a quarter teaspoon. You don't do a lot because baking soda is sodium and it can raise your blood pressure, right? And then, after, you have to ride that out for a couple of days. You do. But if it's still happening, you can go to your doctor and you can ask for a rescue installation, which is an installation of lidocaine with Elmeron or lidocaine with heparin, which will coat your bladder wall, numb the nerves in your bladder. That's why it's called a rescue, because you normally walk out of the doctor's office pain-free after you have a rescue. It's only going to last 4 to 5 hours. Therefore, they might have you do it a couple of times a week for a couple of weeks and then go to once a week for about a month. But oral Elmeron has never been used for flares that I'm aware of in any flare protocol. Lisa says, that's how my prolapse feels. Yeah. Sucks. Marlia says, what will coat the bladder, stop inflammation? I have fibromyalgia and Sjogren's and my whole body's dried out. You're going to look for a chondroitin-based supplement. Elmeron is the original bladder coating. And that's how they believed Elmeron was helpful. And in fact, I even have let's see here. Okay, so look, this is one of the original Elmeron tools. And this is a 3-dimensional view of the bladder wall. And you can see that this is how they said Elmeron worked, that it creates a coating in your bladder so that whatever irritants that are in your urine can't reach down here and cause irritation, right? But we also know that chondroitin, we had a research study released last year at the European Society for the Study of IC, which found that chondroitin was the most effective at restoring the superficial integrity of the bladder wall. Now, that obviously was referring to a bladder installation. The challenge with Elmeron and anything that you take is you have digestion. And digestion is going to render a good portion of whatever you're taking inactive. With Elmeron, 92% was destroyed by digestion, and I don't have data on how much chondroitin is destroyed by digestion. But that said, enough of it gets in there. Obviously, Elmeron was FDA approved because enough of it got in there to become effective. And we are all assuming that chondroitin does the same thing. We do have research with a couple of different supplements like Cystoprotect That was a research study of 152 patients who took it for about 6 months. It was published in the Canadian Journal of Urology, and they found that Cystoprotect was remarkably effective at reducing symptoms in some patients. This was like 22 years ago, somewhere in there, 18 years ago. And now, of course, we have some other supplements that kind of add to that original Cystoprotect formula, like Bladder Builder, which has PEA in it and some probiotics in it that have a few more methods of action that might be helpful. Anne says, I have no idea about my flare. It came out of nowhere. Could be a stress flare, or it could be a hormone flare. If you're under a lot of stress, normally you're going to relax, you're going to tighten your pelvic floor. That's where mine came from. Or it could all be related to, your hormone fluctuations. If you're ovulating, normally women who ovulate will have a 8, 10, 12, 14-hour flare that when they ovulate, and or a flare a couple of days before their period. You guys, if you go to our website, icnetwork.org, and you sign up for our newsletter, there'll be a pop-up window that says, hey, would you like to receive the free IC Network newsletter? Our gift to you is our 40-page flare management guide. And you can print it out and download it. And it will give you hour-by-hour rescue plans. It describes the types of flares that are out there and how to, what the normal rescue plan is for those flares, to try to give you more information on how to approach it. And I want you to know that for anybody who gets our newsletter, seriously, I don't send out spam or abuse it. I might send out a newsletter once every 2 months. I did just send out a newsletter. I didn't even send out a newsletter. I sent out a clinical trial announcement on last Monday. So I don't sell it. It's not going to go to anybody. I haven't sold it in 20 years. We have like 35,000 people who get our newsletter. And I think that's because I've proven through my actions that I'm not going to abuse you in any way. All we're trying to do is give you the latest information. I will have a new newsletter that will probably be done mid to late next week, if I can get the time to do it. If I can get the freaking time to do it. Marcia says, my new Urogyne diagnosed my right pelvic floor is extremely tight. The new pelvic floor therapist says, no. Do I see another PT? Can't get out of pain. Blood work says my inflammation is at 50. Yeah, I think I would get a second opinion for sure, because you're definitely stuck in the middle of two. I mean, if your Urogyne tells you your right pelvic floor is extremely tight, now the physical therapist says, no, I really have to wonder if that physical therapist has had the right training to work with pelvic pain patients. Remember that basic physical therapists don't know how to treat pelvic pain disorders. Their introduction to anything related to the pelvis is incontinence. And so all they're going to do is teach you how to do Kegels. But we don't do Kegels when we have pelvic pain. Kegels will make it worse because we have muscles so tight. The last thing we want to do is tighten them with a Kegel. And understand that the best physical therapy is hands-on physical therapy. That means there's a finger in your vajayjay touching your muscles, or for gentlemen in your rectum, working with your muscles and touching your muscles directly. That's the only way to reach those muscles internally. And it's remarkably effective. And we knew that in 2008 when the first big clinical trial came out. Pelvic floor physical therapy was more successful at reducing symptoms of IC than the bladder medications at the time, including Elmeron. Laura says, my bladder strips are always high with leukocytes. My urologist said she wouldn't investigate the reason. Does this mean I have inflammation? No. No. I usually explain this at every meeting, and so thank you for giving me the opportunity to do this. Think about, let's use this as a model here for a moment. This is a good model. So, let's just say that you are of a tender age and you are approaching menopause. And as you approach menopause, your bladder mucosal barrier is now getting thinner. We call this the genitourinary syndrome of menopause. This is one of the variants of IC subtype 2. So now, unfortunately, your urine is getting where it shouldn't be. Now, these urothelial cells are not passive cells. They're very dynamic, active cells. And they can tell when something is there that shouldn't be there. And they immediately send messages to the rest of your body saying, help, help, invader, invader, invader. And so what happens then is your body mobilizes white blood cells. White blood cells are the warriors in your body. They immediately come to the area to fight off whatever invader is, right? And normally that invader would be bacteria, and it would make sense that you would send white blood cells to the area to kill the bacteria. But in our case, it's not bacteria. It might be potassium. It might be ammonia. It's some sort of chemical irritant in there. But your white blood cells don't know that. Your body doesn't know that. Your cells are screaming, help me, help me, help me. And so your body's sending your warriors. What happens then is they come through here through the blood vessels. But the question is how do they get from here to here? How did they get from here to here? And the answer is that the capillaries open. They release them. But when they release the white blood cells, they also release red blood cells. And that is why we often have microscopic blood in our urine. And it's usually not concerning at all. And that's why you're testing positive for leukocytes. Because again, your bladder wall is under threat. It's sending white blood cells to the area, and it's releasing them into your urine. And so generally, if you have a positive leukocyte and negative nitrite, that's usually just a flare. It's usually just a flare. It just means your bladder wall's irritated. You know, my dad, who's 98 years old, we're dealing with that a lot with him now. And, you know, where he's up peeing every 30 minutes, every 45 minutes. I mean, at 98, things happen. And we test his urine every single time. He's never had an infection. And then it goes away. You know, he literally is having flares. And I kind of go, hey, Dad, now you're living what I lived with for a good 20 years. You're seeing firsthand what it's like to have nocturia. And he is not impressed. All right. So not worried about the positive leukocytes on a urine test. Now, if you had positive leukocytes and positive nitrites, then absolutely, you get your tush over to your doctor, you leave a urine sample because the nitrites are only produced by bacteria. And that's could we classify that as inflammation? I don't know. Marie says, I know different people eat or drink things that will bother one, but not the other. I have the app on what you should or not eat or drink, but I get mixed messages on bananas and root beers, good or bad. So bananas, early on, Dr. Parsons, the guy who invented Elmeron, believed that potassium in urine was the dominant problem for IC patients. And so he started telling everybody to avoid bananas. The bananas would be irritating because of their high potassium level. And so IC patients did avoid them for a decade, maybe 15, 20 years, really that long. But then we had some research studies that were studying the different foods in the IC diet. And you know what they found? That bananas were fine. The bananas rarely irritate patients. The only time I think they would really irritate somebody is if somebody had profound wounds in their bladder, Hunner's lesions in the bladder. So bananas are now on the bladder friendly list. They're not on the caution list anymore. And root beer, the hesitation with root beer is that a good old fashioned like A&W root beer is the best soda you can have because it has zero caffeine and it has the lowest acid level. The challenge is that some soda producers with their different brands of root beer, they started adding extra caffeine to it. And caffeine is like a jackhammer to the nerves. Caffeine is going to make you pee a lot. And so root beer, as long as it is caffeine-free, like A&W root beer, one a week, as long as you're not in a flare, might be okay. You might even be able to get away with it a couple of times a week. I wouldn't plan on doing 2 or 3 a day. I think that would be a mistake, and absolutely no diet. You should not be drinking anything with NutraSeed in it, or I just published an article on this. New research has proven that NutraSweet is linked to cancer and that it's dose dependent. The more you're exposed to, your higher risk of cancer, especially in children. And God forbid you be pregnant, especially in your fetus. You go to our website and learn more about that. Judy says, I noticed that the supplements are not FDA approved. You're right. Supplements are not FDA approved. Supplements are considered food grade supplements. So no supplements are FDA approved. What's FDA approved are formal treatments. And for them to go through the FDA approval process takes millions of dollars, and many years to do the research to prove that it's effective. They've got to do the baseline studies to make sure it's not toxic to animals. Then they've got to do dose ranging studies to find the right dose. Then they've got to do that in animals. Then they have to do that in humans. And it takes years to do. And that is one reason why we have no new FDA approved therapies. Right now, we only have 2 FDA approved therapies for interstitial cystitis. One is Elmeron, the second is DMSO. And those were approved. Elmeron was approved in 1996. DMSO, I think, was approved in the 80s. I'm not sure the exact date. And I don't think we're going to ever see any more FDA approved medications. I don't know of any company that is going to invest the money in it. And the one we should have is Lyris, because that's the only treatment in history that's healed Hunner's lesions. But Allergan apparently does not believe that it's going to make them enough money, so they've shelved it. Judy says, how can we get a hold of the documentation that you just showed about the COVID? Again, go to PubMed, pubmed.gov. That's the National Library of Medicine, and just search for COVID cystitis, and it will come up, and I will be putting a blog on our website that will go through it. Cindy said, blueberries work for me, but bananas are a problem. Maybe the spicy shrimp the other day. Yeah, spicy shrimp. We don't do well with spicy, hot, spicy things. I mean, they just don't usually work for us. Vicky says, what causes flares when you have a cold? Histamines? I don't know. I don't think anybody's ever explained that. Anne says, does Procystic help with flares? The supplements in general are, with the exception of Preleaf. Now, Preleaf could immediately help with a flare by alkalinizing your urine. So if your flare is caused by drinking a soda or something you shouldn't have done, Preleaf has the potential of giving you an almost immediate response in the right direction, because it will immediately alkalinize your urine. And so that's treating a symptom. It's not addressing the underlying cause. And the underlying cause is bladder irritation. That takes time to resolve. Everything takes time here. So you gotta differentiate in your brain cause and effect. So the symptoms are the effect. And our job here is to try to figure out the cause. What is causing the symptoms? And listen, for everybody watching this right now, you got to understand, there's tremendous diversity in you guys. For some of you, it began in childhood. For others, it began after menopause. For some of you, it began after getting hit by a car. For others, it began because you were a ballet dancer or a football player or a paratrooper. For some of you, it began after chemotherapy or using ketamine, while for others, there might be some inheritance in here. And so we don't treat them all the same now. We're doing something called subtyping. And across the IC world, a lot of different doctors are working on their own different subtypes. I use the system created by the guy who ran the Stanford IC program. But that said, everybody agrees Hunner's lesions is its own unique disease, which we're calling it Hunner's lesion disease. If you have Hunner's lesions, you are in your own unique group. For everybody else, you've got bladder pain syndrome or pelvic pain syndrome, and we've got to try to figure out what's causing it. It could be Tarlov cyst of your spinal cord. It could be a fibroid tumor pushing on your bladder. It could be chemical irritation of your bladder. It could be estrogen atrophy. There are a lot of potential causes. Let's see here. Marie says, are we not supposed to take potassium? Yeah, potassium generally, if you have a bladder wall issue, is usually going to be a bit more challenging for you guys. Christy says, I'm so craving a pop. Is there any pop that IC patients can have? Again, it's going to be an old-fashioned root beer without caffeine. Melissa says, I've had IC for a couple of years, currently treating with instills. I've just been told I'm needing a hysterectomy. Any resources if surgery could cause IC to become worse? So, Melissa, that was exactly my question. I had to have an emergency hysterectomy 4 years ago for uterine cancer, early uterine cancer. And I could have cared less about the cancer. I just wanted to make sure it didn't set me back 20 years in healing, because my IC is extremely controlled now, and I haven't had severe pain in a long time. And so it's the only time in history I actually reached out to our medical board members for me. And I gave them my report as to why they thought I should do a hysterectomy. And I specifically asked them, will this set me back? Every single one of them said no. They said no. That generally, what they do is what I had was uh, what did we call it? Laparoscopic assisted total vaginal hysterectomy. So what that meant is that I had 4 incisions on my belly, and then they removed everything through my vagina. They took my cervix and they pulled everything out that way. And it's much less invasive and much less traumatic. Same with Da Vinci. It's a robotic. Is that the right word? I think that's the right word. Anyway, in any case, that's very different than having a belly suture, a belly incision, either a bikini incision, or the worst incision is the up and down incision. That's the hardest one to recover from. There's a fabulous website called Hystersisters, hystersisters.com. That's who I use. Go on over to there, and they will have everything you need to know about hysterectomy and how to recover, and your options, the different methods that are used, the pros and the cons. They have a massive support forum, and they're wonderful. I will tell you that recovering from hysterectomy is a beast. Even if they do the laparoscopic assisted, literally going to be walking around slowly for a couple of months, and you're not going to be able to lift anything for at least 6 months. It's big surgery, but I'm here. I have a video on YouTube. I have 2 videos on YouTube. Or let's see. I have 2 videos. One when I got home from the surgery when I was medicated. Saying thank you to everybody for their support. You never film a video after coming out of the OR. Yeah, that was a mistake. But then I tell my story and about we ignoring some of the early symptoms of uterine cancer, like spotting. So go over to YouTube and check that out. Christy says, my hysterectomy caused me to get IC. Wish you the best of luck. So, Christy, there are really only 2 ways that that's going to happen. Number one, if they damage your bladder. So normally when you have a hysterectomy, they do a hydrodistension immediately afterwards to make sure they have not perforated the bladder. They did not for me, and my bladder looks fabulous. It was great, really good news. But the other thing that really happens after hysterectomy is pelvic floor dysfunction, because your pelvic floor muscles have been potentially cut, injured, traumatized. And so for patients who develop quote unquote IC after hysterectomy, we're really in all likelihood going to be looking at pelvic floor tension, or we're going to be looking at estrogen atrophy. because if it's a total hysterectomy and they take your ovaries, then you're going to go into menopause very, very quickly, and that's going to affect the bladder wall. Your bladder has this nice thick coating of mucus, which acts as a barrier that prevents urine from irritating this tissue. We call it the mighty mucus. Unfortunately, this mucus is estrogen dependent. So when you're young and you have lots of estrogen, you have lots of mucus. You can get away with stuff. When you're older, you have much less estrogen, much less mucus, and things are starting to get dry. If your vulva is dry and your vagina is dry, then so is your urethra and so is your bladder. And that's called the genitourinary syndrome of menopause. And so those are the odds, Christy. Those are the odds. You're either in GSM from estrogen atrophy or you're having pelvic floor tension. This is not, we're kind of taking a step back from this mysterious bladder disease. Remember, 25 years ago, they told everybody IC was an incurable bladder disease. We don't think that anymore. IC is the pelvic pain syndrome. Why? Because structures outside of the bladder are often causing the problems. Okay, let's see here. Graciela says, if my uterus shows no findings, do I need to take Elmeron for repair? Well, honey, your uterus is not your bladder. Did you mean to say your bladder? Elmeron would not be helpful for the uterus at all. So you have UTI and yeast infections from time to time. You get vaginal spasms that has you in tears. I would want to know what's going on with your pelvic floor, hun. So again, same thing for you. Same thing for you. The quality and health of your skin. If you're dry, then you're in estrogen atrophy. So we have to treat that with a little bit of estrogen or something else that will quench that dryness. And also, what could also be causing some of those spasms? Are they actually vaginal spasms or are they pelvic floor spasms? So we really kind of need to know what's going on with your muscles too, right? Hi, Kelsey. It's nice to see you too. Anne says, how do you know what kind of flare you have? I have a wand and I go for pelvic floor therapy and feel like a fire truck is up there, pressure. Well, the easiest way to differentiate between a bladder versus a pelvic floor flare is when is your pain the worst, before you pee or after you're done peeing? If you have pain before you pee, that's pointing more to your pelvic floor, your bladder wall. If you have pain after you're done peeing, it's pointing more to your pelvic floor. But another critical question that will really tell us right away if your muscles are involved is how quickly can you pee? Can you sit on the toilet and release urine right away? Or are you hesitating 5, 10, 15, 20, 30 seconds before you can release urine? If you're hesitating, you have pelvic floor dysfunction. Hi, Lori. Cindy is now in Sonoma. Is that Sonoma, Virginia or Sonoma, California? If you're in Sonoma, California, girl, you're close to me. That's awesome. Lori says, are there any resources to assist to apply for permanent disability? Yes, over on the IC Network website, we have a disability resource center. It's all there, everything you need to know over there, icnetwork.org. Just go look at their disability resource center. Linda says, potassium sorbate, which is a preservative, affects me badly, but not bananas. Good point. So Cindy wants to know what the best time to call is. You saw a urogynecologist on Wednesday and you got more disappointment. Girl, I am sorry. So, guys, I work with patients every day. I will tell you that I do most of my phone work afternoon Pacific time. I'm usually on the phone from about noon to 7. So it's kind of first come, first serve. I would start calling around 11 Pacific. And if you get me, great. If you get my service, that just means I'm working with somebody already. It's kind of first come, first serve. if you want to go ahead of the queue, you can sign up for a coaching, and the coaching patients always get first priority. Linda says, when I'm sick, my bladder calms down. Actually, probably what's happening, Linda, is your brain is paying attention to your other symptoms, and it's starting to ignore your bladder, which is a good thing. Brenda says, my physical therapist wants me to do Kegels, so I will be more aware of the muscles to be able to relax them. Well, you got to learn how to work with the muscles first. So, I mean, yes, normally what they would have you do, the way we know if we're with the right muscles is as you pee, if you stop your stream, that's your pelvic floor, and then you relax. But you don't do that every time because you're going to mess up your urination. That's the last thing you do. There's something called a quick flick. And a quick flick is where it's kind of like a Kegel that's very, very brief, and the focus is on the relaxation. So you tighten for a second, like, oh, and then you release for 5 seconds. So it may be that they just want you to do what they call quick flicks. Roxanne says, my blood pressure medication irritates my IC. You know, I've heard that before. I occasionally, if my heart starts to get a little funky, and my heart is known to get a little funky every now and then, especially if I'm exposed to caffeine, I use low pressure, but I don't take it every day. So I've never noticed a flare with low pressure. Tabitha says it's safe to take curcumin to reduce inflammation. I bought the pills and they are 500 milligrams each. I think, I think it's just one of those situations where you just have to try it and see how you feel. Sylvianne says, thank you. Love all the helpful information you give us. Gives me a sense of security. I want to give you control. Our goal is to give you control here, guys. We need you to be able to step in when you're having a flare and try to nip it in the bud. That's why, some patients are like, I don't want to go to physical therapy. I don't want somebody touching me down there. It's like, seriously, guys, this is so that you can learn how to do it, so that when you start feeling your muscles get tight, you can nip it in the bud. It's about learning skills. This is skill building here. Jacqueline said, went to a urologist. He said, IC doesn't leak. Said I had overactive bladder. Gave me meds, bad side effects. Didn't do much for the urges or leaking. Found out after a 5-hour road trip with no stops to pee, he was wrong. One thing I've noticed is you just about have to become like a scientist to figure out what your causes of urge an issue. Jacqueline, he's right in the sense that incontinence is not a symptom of IC. IC patients in general do not leak. But there's always variance. If, for example, you have genitourinary syndrome of menopause, which then your muscles start to get a little bit weaker, and yeah, you might have a little bit of incontinence for that. Every now and then, I feel like something. Like I don't leak in gushes in any way, shape, or form, but I am 61, my friends. And every now and then it's like, uh-oh, I better get to a bathroom. M says, are there any vitamins taken orally that will cause a flare? Pretty much all the multivitamins on the market are going to irritate the bladder if it's a multi. So we have a fabulous low acid multivitamin. Let me get it. Where is it? You know what? I have it in another room. Hold on. I'll be right back. Oh, my legs are stiff. Oh, goodness me. Did you see when I stood up, like my right leg tried to give out a little bit? It's from 2 compressed discs in my back. So frustrating. It feels like there's a belt tied around my thigh. All right. Okay. So the vitamin is the low acid vitamin that we suggest is the Bladder Smart low acid vitamin. This is what I take every night. Never flared from it. Heather says, "Hi Heather. Hey girl, I got your email earlier. I just didn't have a chance to reply. God, see now my leg is all messed up. You just started having blood in your urine and you know what to do. Well, if you are peeing bright red blood, that is a call to your doctor immediately, especially if it's continuing. If it was just one time, then you want to let your doctor know, but we wouldn't consider that an emergency. But if you're passing big blood clots or you have blood in your urine or your toilet's pink or red, that's usually a visit to urgent care just to make sure you don't have an infection. And if that comes back negative, then your next question is going to be to your urologist, can you please tell me what's bleeding? And normally they would do a cystoscopy to look at your bladder to see if anything's bleeding there. Sorry, it's my thigh. I need to put my knee brace on. Lorraine says, can my spinal stenosis and degenerative disc disease in my lower back cause my IC? Well, it could irritate nerves, as obviously I have the same thing, and it's affecting my right leg pretty majorly. I would be looking at potentially nerve inflammation that can be shared down to the bladder or muscles. Like I will tell you, the right side of my pelvic floor is mush right now because of my my compressed discs. You know what? Hold on a sec. I'm going to go get I got to put some Tiger Balm on my thigh. Hold on. And I would demo it, but I don't want to drop trow in front of you. Be right back. All right. Oh, to be human. For anybody who has muscle pain, this stuff is the bomb. Tiger Balm, ultra strength. It has a strong smell. It's kind of like a tropical Vicks Vapor Rub smell. I mean, it's very interesting. I happen to really like it. The only thing with this you got to be careful of is you got to wash your hands really well afterwards. And God forbid you then go to the bathroom and it's on your fingers and you accidentally get it on your tender bits. That would not be the happiest thing in the world. But anyway, Tiger Balm, I use it regularly on my glutes and any muscles that are hurting. And then also where is it? Arnicare. Arnicare is really good. It's arnica, and this can also, you rub it into your skin, and this can also reduce some muscle pain. And then I have a third one. Where is it? Where is my third one? No. We also have a CBD. We also have a CBD cream that can be used, rubbed into your skin in our store. Now I got to put a Band-Aid on. I'm kind of a mess today. Hold on. I took off part of my finger with the shredder. Hold on a sec. Mm-hmm. All righty. All righty. You guys, let's take a deep breath here for a moment. Let's just do a check-in here for a moment. How are you feeling? Are you feeling calm, collected, at peace? Let's just do a little check-in with our bodies here for a moment. Let's do a quick I spy, because we know that when you're anxious, your brain is going to intensify the pain. We know that when you're laughing, your brain will or minimize the brain. And we also know that pain will put you into fight or flight. And we want to try to get you out of fight or flight. I was doing my affirmations this morning. I just didn't have a good couple of days. My legs have been really hurting me. So let's just do a quick, fun I spy. And then we'll come back to your questions or we'll start the Zoom. Okay. So number one, if you could look at anything that would put a smile on your face, what would it be? If you could look at anything that would put a smile on your face, what would it be? And for me, it would be a monarch butterfly or an animal that I could pet, a cat or dog. So live in that for a moment and let's take a nice, slow, deep breath in and out. If you could hear something that would put a smile on your face, what would that be? Would it be music? Would it be your mother on the phone? Would it be children playing outside? Just live there for a moment. And for me, it would be a John Denver song, a Kenny Loggins song, or a BTS song. Okay, so let's just live there. And we're going to breathe in and breathe out. If you could smell something that would put a smile on your face, what would that be? What could you smell that would put a smile on your face? I know it'd be for me. Easy peasy, a hot cinnamon roll in the oven, which I made last night. And I've had 3 because I deserve it because I'm under stress. Okay. In, out. What could you taste that would put a smile on your face? What could you taste that would put a smile on your face? For me, anything coconut, or again, cinnamon roll or hot apple pie. So let's live there for a moment. Now let's take a deep breath in and a deep breath out. What could you touch that would put a smile on your face? What could you touch that would just make you feel so good? What would that be? Petting a cat? Petting a cat for me. Petting an animal. Live there for a moment and let's go in and let's go out. Let's do a couple of, hey, you know what, man? We're doing it for each other. I need this right now, and I think you guys probably need this too. Let's do a couple of affirmations. I can do all things. Say it with me. I can do all things. I am enough. I am enough. Every day, in every way, my life is getting better. Live it, keep saying that to your brain. Don't assume the worst. Let's give yourself something positive to focus on. If you're going down the dark hole of the world is against me, that's going to be hard. We have to stop that negative self-talk. I have never been more prepared to deal with what happens to me than I am at this very moment. Because I am one day older and one day wiser. And you have to remember that the mistakes you made years ago, you learned from those. You're not going to repeat that again. You are truly one day stronger and one day wiser. And I know that IC makes you feel weak and it makes you feel vulnerable, and it gets frustrating, especially if you're in pain and you have doctors who are not believing you and listening to you. And I need you to walk into your doctor's office calm, collected, informed, and ready to talk turkey with them. I want you to walk into a doctor's office and burst into tears. That's not going to help. I don't want you to walk in a doctor's office and I say, I need pain care. That's not going to help. You have to walk into your doctor's office prepared to talk about your symptoms. Do not put your doctor up on a pedestal and do not put him beneath you. We're talking, they are a man or a woman. You are a man or a woman. Peers. You're going to treat them like peers. You're going to walk in and say, here are my symptoms. I have not slept through the night in 5 years. I am getting up 5 times a night. I cannot start my urine stream right away. Sometimes it takes me 5 seconds, 10 seconds, 15 seconds, or a minute, or 2 minutes, or 3 minutes. Doctor, every time I have sex, it hurts. Sex has always hurt. I am here because I want you to help me understand why my body is in pain right now. And then when the concept of pain management comes up, as it will come up for all of us at one point in time, rather than asking for pain meds, the way you do it, because you got to remember, your doctor diagnoses you based upon observation and based upon their experience. So they're going to look at you. Are you acting like somebody who's in pain? Right. But then they're going to go, they always judge that based upon their own experience. And the problem is that they've never had IC pain. You could say you're in pain and they're like, yeah, right. So you got a cut on your hand, put a Band-Aid on it and walk away. They don't understand the depth and breadth of this pain. They don't understand the depth and the breadth of bladder pain. There's only one doctor in the world who is willing to undergo a test to try to understand what IC felt like, and that was Dr. Chris Payne. And they had him fill his bladder with protamine, something very, very irritating, because he wanted to know what the hell y'all were talking about. And so he is like, all right, let's do it. I want to know what this feels like. He was stunned. He lasted less than a minute before they drained it out. He's like, oh my God. He understood. So your doctors in general don't get it. They've never had this before. So you've got to describe it in terms they understand. Doctor, this pain is so severe, I cannot sleep. Doctor, this pain is so severe, I cannot go to work. Or if I go to work, I have to get up every 20 minutes and pee. Or if I'm driving to work, if I hit a speed bump, I scream, which is what happened to me my first year. Doctor, I cannot sit through church. It hurts too much when I sit down. Doctor, I cannot drive my children to school. I cannot go to a game because it hurts too much. What can we do to improve my functionality? What can we do to give me what can we do to help me do the things I need to do? Understand that the difference between an addict and the responsible use of pain meds is an addict takes pain meds to escape life. They can't cope. They're trying to break away from it. A responsible use of pain meds is if you're trying to perform the things you need to do to get your work done. So it's a completely different mindset. If you want to, again, addicts are trying to escape life. The rest of us are trying to use a little bit of pain medicine so that we can do the things we need to do to get better, whether it is physical therapy after surgery or whatever. I can do all things, insert your faith, which strengthens me. Every day in every way, my life is getting better and better and better. That which is done for you, let it be done. That which you must do for yourself, do it. Do it. Open your bedroom door, open the drapes, let the sun shine in, get up and start moving around. The more you move, the more you give your body an opportunity to build up endorphins, your natural pain fighters. One of the best things you can do is just get up and go walk up and down your street a little bit. That has the potential of helping. And for those of you who are new, this is our new book, IC 101. It's not just a bladder disease. And right now in our store, you can get it $9.99 as a PDF file. It's $24.95 in print. It costs $19 to print this up. So it's not like this is the big money maker. This is not a big money maker. Then we have to, so anyway, get it while you can, because it's going to be up on Amazon, and we had to raise the price on Amazon. So it's $24.95 in our store. It'll be $28.95 on Amazon. And we have those books in, and they'll be going up this week on Amazon. Our Kindle is almost done also. All right. Anne says, I don't get pain with urination. Good. And again, we normally, the people who get pain in their urethra when they pee, we're really looking at estrogen atrophy or infection. Generally, IC patients, we tend to have more pain if it's our bladder wall on our bladder as our bladder fills with urine, or after you're done peeing. But peeing itself usually isn't that painful unless we're dealing with a really tender urethra for one reason. So Cindy says, hi, Jill, I'm desperate. I've used vaginal estradiol to treat estrogen atrophy since January after having multiple urinary tract infections and too many antibiotics over 3 years. I originally saw a urologist about prolapse surgery, but I was told my tissues needed to regenerate with estrogen because they were completely atrophied. What are your thoughts about having bladder prolapse surgery if you have IC? I have chronic pain, mostly in my urethra. And I feel like my bladder is putting pressure on my urethra and causing pain. So Cindy, I need you to go over to our website and read the blog we just put out about a woman with severe IC who had Hunner's lesions, who also had a prolapse. And when they repaired the prolapse, her Hunner's lesions healed completely. She was cured. And this was a case study published in a major urology journal this summer. So, I mean, I think that they're right. I mean, you guys, estrogen atrophy causes very weak, fragile tissue. And so the doctor said her tissues were so weak that really before they could do surgery, they needed to give those tissues some estrogen to strengthen them. So you've been doing now for 8 months. Things should be better. Your urethra should be better. Hopefully they have given you estrogen cream that you can rub at the entrance to your urethra also, because the urethra is kind of like the canary in the coal mine when it comes to estrogen atrophy. And so it's usually the first part of the urinary tract to start screaming when your estrogen levels drop to a certain point. You know, at some point in time, I mean, I understand your fear. I had the same fear when I had my hysterectomy of what that would do to my IC. You have to understand that as long as your bladder is out of position, it's not going to be a normal, healthy bladder. And so trying to repair that prolapse is really important. So again, go to our website, go to that case study, read that case study, and I might give you a tremendous amount of encouragement. Kayleen says, I get agonizing pain when I have to pee, then my whole bladder, urethra, and vulvar pain when I'm peeing. Girl, I'm so sorry. And you've got, Kayleen, remember, you got a lot of stuff going on down there. You got a lot of stuff going on down there, a lot of which is originating in your low back. So it's hard, you are apples, oranges, and bananas all in one pelvis, But the dominant factor for your case still is a severe spinal issue. Lorraine says, what about steroid injections? They do steroid injections, triamcinolone injections into Hunter's lesions. She says, wait until you're 71. I'm dreading it. No. Oh, getting older is so weird. It's been a rough year for me. Sierra says, how can I get a cure of IC? Well, honey, remember, Sierra, you and I have talked several times, hon. It's not, the cure is the wrong word. It's heal. We have to try to heal what's wrong with you. So it could be your bladder wall, it could be your pelvic floor, it could be a fibroid tumor, it could be endometriosis or something else, and so there's no magic cure here. There's no magic cure. Christy says, oh, wait, here, hold on a sec. Anne says, if you don't have pain, is it IC? Yeah, if you have frequency, urgency, if you're up all night peeing, that is still considered potentially IC. But again, we need to break it down based upon subtype, and that could easily just be genitourinary syndrome of menopause causing that. Christy says, my urologist is going to try to remove my scar tissue and have a flap that's hanging down. I had 4 surgeries with no relief. The mesh that was used was recalled and caused a bunch of damage. Yeah, girl, I'm so sorry about that. Karen says, I'm waiting realignment spinal surgery. Will the ketamine infusions be a problem post-surgery? Well, it's about dosage. Karen, it's about dosage. I have a website called ketaminecystitis.org. And that really relates to addicts who are using massive amounts of ketamine every single day. And when you use ketamine in high quantities, it can certainly damage the bladder wall. It's kind of like an industrial solvent. But when you use it in small doses for medical purposes, it might be much more gentle on your bladder and you might not have any problems with it. Or it may be that in addition to the ketamine, you could also be doing something that would protect your bladder wall, like, bladder builder or bladder rest or Cystro Protect, something maybe like that would give you some extra chondroitin or something. Alyssa says, can you describe the difference between neurogenic bladder and IC? Oh, what comes immediately to mind is the symptom of urgency. It's what is driving you to the bathroom in the middle of the night and you feel urgency. Are you running to the restroom because you feel like you're going to leak? Are you running to the restroom to reduce pain? And now I'm no expert in neurogenic bladder. I think for some people with neurogenic bladder, you feel like you need to pee, but you can't pee because the nerves are damaged. Or it's just not working in the normal pathway or sequence. You know what I'll do is I will ask the next time I talk with one of the top IC doctors, I will try to get a better answer for you, Alyssa. Nobody's ever asked me that question before. So I'm going to have to try to figure that one out. I know that I just like there's something flittering in my brain right now that is just not coming out about the difference between neurogenic bladder and IC. Maybe I can find it. Here, hold on. It's like right there in my brain. All right. So there are 4 different types of neurogenic bladder. One is called uninhibited, which is damage from the brain or like a stroke. And this is where you don't feel fullness. You have a low bladder capacity and or incontinence. Then there's something called spastic neurogenic bladder or hyperreflexive bladder. The muscle of the bladder and the urethral sphincter are not working. That's what it was. They're not working together and are usually tightly contracted at the same time. Then there's flaccid bladder, also known as lower motor neuron, hypotonic bladder, where the muscles of the bladder lose the ability to contract normally. And then there's mixed, where you can have, depending upon the day, I mean, you can have a spastic bladder muscle, but you can have an overactive sphincter. And anyway, things are just not working together. I don't see it a lot in the typical IC patient community. Really, I think the context that I've seen it in more is in people who cannot urinate, that things are really, 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 really tight. The sphincter is tight, the pelvic floor is tight, and the bladder wall is tight. Thus, it makes it very hard to urinate, and these patients will often have to self-catheterize. When we think about pelvic floor dysfunction, and we think about spasms, you can have a bladder spasm of the smooth muscle of the bladder, or you can have a pelvic floor spasm from the skeletal muscle of the pelvic floor. And in some cases, that is triggered by a neurological disease. It's part of the, you are a mystery to be solved. You are an anatomical mystery to be solved question. Ravonda says, do you know of any muscle cream that doesn't have a smell? Yeah, you know what? The CBD cream that we have in our store does not have much of a smell. I think I've got it here. Hold on. I think it's here. Hold on. Let me see if I can find it. Okay. All righty. So this one, Sagely CDB cream, and we don't sell this one, but this is one of the ones that we got and tried. My mother uses it right now. And it works. There's no smell to it. Nothing. Darlene said, yes, Darlene, this is on YouTube. Cindy, it's right on the front page. Cindy, would you explain where to find the blog post on the woman who did much better with her IC? It's right on the front page of the website. Woman cured after bladder prolapse surgery. It's also in our magazine. So you guys, our summer magazine was released last week. Hunter's lesion patient unexpectedly cured. So it's right on the front page of the IC Network website. But if you get our magazine, you just go to your member page and you can download our magazine and read it there. How do you apply the CBD cream? You just rub it in. You just rub it in. All right. You know what? Let's go ahead. I'll go ahead and start up the Zoom. Let me start up the Zoom stream. If anybody wants to come in and talk to me directly and personally, we can do it as a Zoom. And let's see if anybody wants to do that. If not, that's fine. If not, that's fine. I am here at your pleasure. I will stay on as long as you want me to stay on, but if you're done, and that's fine too. So hold on a sec. To get into our Zoom meeting, you go to our website, icnetwork.org, and you go to support, and then you click on streamed support group meetings, and I'm going to start up the room.
Recording in progress.
Okay, you heard it say recording in progress, but just so you know,
recording stopped.
I don't record the Zoom meetings, so you don't need to worry about that. And so I'm going to, let's open this up. Let me get this invitation, copy invite link. All right, so for my friends on YouTube here is your link. Anybody wants to come into Zoom, feel free. If not, that's okay. Now, Facebook here, hold on. I got to get this in a different way for you because you're on a completely different computer here. So again, I'm going to the main website. I'm clicking support, and I'm clicking the second link, streamed support group meetings. Whoops. That went a little far. Hold on. Patience, patience. All righty. So people on Facebook, there is your invite on Facebook. So let's just see if anybody wants to Zoom. If, just understand that I'm going to keep Facebook and YouTube open so people will be able to hear you, but they won't be able to see you. All right. So let us see. All right. Okay. So the Zoom meeting is definitely open. Okay. Hey, Ileana, you guys, somebody very important. So very important is in the meeting from Facebook, and that is Ileana Brockman. Ileana Brockman is a old support group leader like me. Man, we've been around a long time, right, Ileana? And Ileana is the one who started this company, IC Relief, that makes these fabulous wands. And we all owe Ileana, girl, I have used this 3 times in 3 days because my pelvic floor is not happy with me right now. You are an angel to the IC world, and we are so grateful for what you have done. Seriously, you've created a fabulous resource for all of us, and I'm so personally appreciative to be able to have something that really helps me with my pelvic floor. Carla says, I'm finding that taking a combination of CBD and CBG are helping with pressure and inflammation. Just wanted to put that out there. Hey, Carla, if you could tell us specifically what you're taking, that would be great. Because again, anything that reduces inflammation is important for us now that we have COVID-associated cystitis. COVID-associated cystitis, which appears to be part of the cytokine storm that's happening in COVID patients, as well as long-term COVID patients. And Ileana, that's how we started the meeting with a new paper from Ken Peters' clinic. COVID-19 inflammation results in a urine cytokine elevation and causes COVID-19 associated cystitis. So it's all about fighting inflammation, finding new and novel ways to reduce inflammation. And so, Carla, if you could tell us what you do, or if you could message me and tell me what you do, it's really important that we share stuff now. We really have to work outside of the box because these COVID-associated cystitis patients are not responding to typical flare methods. And the pain can be quite intense. And so what we want to do is is share what we've got while the doctors try to work on their protocol. We don't have a published protocol yet, although Dr. Theoharides is working on a paper. All right, any takers? Any takers on Zoom? If not, I'll turn it off. Good. All right, we're gonna let that one go. All right, guys. Well, we've been doing this for about 2 hours. Yeah, I know. I don't know what's happening. Facebook, this happens a lot with Facebook where the quality of the stream gets messed up. Facebook, you are on AT&T, and my YouTube computer is on Comcast. So it's either an AT&T issue or a Facebook issue. So, all right. Well, listen, any last questions? Any questions? Last call for questions. Last call for questions. Okay. Well, I'll tell you what. Listen, love you dearly. How do we start this meeting? By saying, listen, you are not alone. On those deep, dark nights when you're feeling terrible, please remember that you are surrounded by sisters and brothers with IC who stand with you, who support you, and who want to care for you. Laura says she wants to know about the doctor list. Okay, we can do that. Let me pull that up. And then if anybody is looking for a potential referral for a physical therapist in their area, you just need to give me, let me get that list up, your state, and I can go through this list for you and see if we can find somebody for you. All right. So I know that somebody asked about Florida. So let me look at Florida first. 4 urology clinics. 4 urology clinics are listed. Now, this is a database from Harvard Medical School on pelvic pain, for IC and pelvic pain. So the 4 clinics are going to be the Cleveland Clinic, Florida, although it looks like their biggest interest is working with men rather than women, but it's worth a phone call anyway. Then we have Mount Sinai Medical Center in Miami Beach or in Aventura, Florida. Dr. Laura Chang Kitt at Encore Urology in Naples, Florida. That looks very good. And this is very good too. Avant Concierge Urology, Dr. Parakatil, who co-authored 2 chapters in the book Facing Pelvic Pain. So that looks good. And in terms of, there are quite a few pain management doctors listed in Florida, 2 physiatrists who will help you try to understand why your muscles might be tight and what could be going on there. So we got Andrew Dubin at the University of Florida Orthopedics and Sports Medicine Clinic, and Marjorie Momsang in Pelvic Rehabilitation Medicine in Miami, Florida. And then lots of physical therapists, lots and lots of physical therapists. So if you give me a city, I can go through that. Cindy, for Northern California, unfortunately, Cindy, Dr. Chris Payne was our top contact in Northern California, and he is retiring at the end of the year. So if you want to get in, you got to get in the next month. He's going to stop taking new patients probably in 2 months. Okay, so it'd be Dr. Christopher Payne at Vista Urology in San Jose. Of course, you could always try the University of California at San Francisco. Dr. Marshall Staller is there. They tend to be a little bit more proactive. And let me look at California here. Hold on. I'm sorry, I totally forgot Phil Hanno at Stanford. Phil Hanno is the top doctor in the American Urology Association and the National Institutes of Health, the most influential doctor ever for IC research and IC funding. He is the chairman of the AUA Committee on Interstitial Cystitis that created the IC guidelines for the AUA. So he is at Stanford. Amy Duberful at Stanford and Dr. N.M. Chukwu at Stanford, and Jeanette Potts at Vista Urology, although her specialty was really men, and she too is retiring. And again, in terms of physical therapists in Northern California, we have excellent physical therapists in Northern California. Pelvic, go to pelvicpainrehab.com. They are wonderful. The Pelvic Health and Rehabilitation Clinic. They have clinics San Francisco, Vallejo, Los Altos. They have several clinics throughout California. So you got really good physical therapists in Northern California. And there are more than that. Let me see. Lori says, you're a gynecologist in Southern California. My list is urologists. It's not urogynecologists. The closest they have is UCLA. UCLA Burbank Urology and UCLA Westwood Urology. You know what and then in terms of physical therapists, you've got Nicole Kosian at Pelvic Sanity, as well as several other outstanding physical therapists down in Orange County and in the LA Basin. So what I would do is I would give them a phone call and ask if they work with anybody in the San Fernando Valley. The Pelvic Health and Rehabilitation Center in LA would be the one I would call. So we've got Burbank, California. That's too far away. Camarillo, California. That's too north. Chico, Dana Point, Encinitas. I don't know if Encinitas Pelvic Health and Rehabilitation Center has a clinic in Encinitas. Newport Beach, Irvine, La Jolla, Laguna Hills, Pelvic Sanity. Nicole Kosian and her team are in Laguna Hills. Deconstruct Health in Long Beach. Sarton Physical Therapy. There's a great physical therapy clinic run by Julie Sarton in Los Alamitos. Laura Frazier, as she's up here at Stanford. Goodman Physical Therapy in downtown LA. Let's see, Mission Viejo, Sarton Physical Therapy in Mission Viejo. Fusion Wellness in Montrose. Tri-Valley Urology in Murrieta, California. Amy Block in Newport Beach. Amy Block Physical Therapy. Laura Horn Physical Therapy in Pasadena. Fundamental Physical Therapy in Poway. Obviously, there's a ton. So if you want, you can call me this week and I can go through more for you, okay? Yeah, Laura Horn in Pasadena, exactly. Nancy said, let's see, and Canada, Quebec, Montreal. That list is pretty small, my dear. Canada, the two doctors up in Canada who are really good at IC have retired just in the last 6 months. A lot of Canadian patients come down to the United States. They do. It's rough in Canada right now to have IC. Nancy says, has anybody with IC had adverse reactions? Nancy, as I said, when we began the meeting, I'm going to say about 90% of IC patients, maybe 95% of IC patients who get the vaccine have no problems with it at all. I had Pfizer, no problems. Somebody else was in the meeting who had the Moderna, absolutely no problems at all. There's a very small subset of patients who do appear to have a bit of a flare with the vaccine that might last a couple of weeks. That's in stark contrast to the months-long severe flare that can happen in patients who actually get COVID. And we now know what that is called COVID-associated cystitis. So if we're considering the risk of the vaccine as compared to the risk of the disease, I take the vaccine over the disease anytime because of what we know now. And we talked specifically about this new paper that came out. COVID-19 inflammation results in urine cytokine elevation and causes COVID-associated cystitis. And this just came, actually, the formal publication date is September 1st or October 1st? September 1st, I think. They always release them a little bit early. No, available online November 5th. It received August 6th. Okay. Wow. Okay. Chrissy says, you go to Tri-Valley. Sometimes you have to ask for it. Nevada. Okay, Laura's looking for Nevada. Let's see what I've got in Nevada. Nevada, again, is a pretty difficult state. But, you got to be the squeaky wheel. Got to ask for help. That's why we got IC Awareness Month coming up, guys, right? I mean, it starts September 1st. And this is where you get to make a difference in your community. And we will have a press release you will be able to download from our IC Awareness website that you can send to your local papers to try to improve knowledge level in your community. I mean, because if not you, who? If not you, who? I mean, we are all in this together. Every voice matters. Every voice counts. The Harvard database has nobody listed as a doctor in Nevada. If you're up by Reno, there's a doctor in California. You might be able to come down to Sacramento, or you might be able to go up to Redding. If you're down in the Vegas area, you're really going to have to make some phone calls. I do have some physical therapists in Vegas Physical Therapy, Summerlin Physical Therapy, Select Physical Therapy are all in Las Vegas. And then Rhonda Fiorio does physical therapy for IC in Reno at Back in Motion Physical Therapy. And then there's also somebody in Henderson, Nevada. So again, this is kind of one of those, moments when you really almost have to call the physical therapist and ask them who they normally work with when it comes to being referred to physical therapy. They will have a better idea for you on who would be receptive. So I would give the physical therapy offices a call. Does acupuncture help? Yeah, acupuncture can certainly help some people. It's certainly viable. We've got some research studies behind it. It's listed as a step 1 treatment option in the AUA treatment guidelines. Hey, Sierra, I turned off the Zoom because nobody came in. So Karen from Canada says, yes, 6 Canadian urologists have retired, including mine, Dr. Leslie Carr. Oh, heartbreaking, because Leslie Carr was an outstanding IC care provider. Laura goes to UCLA, yeah. Good. So you're going to Summerlin. So you're starting Friday. Good. So you guys, when you go to physical therapy for the first time, now listen, you got to know your bits. You got to know where the muscles are. So it's really important that you bone up a little bit on where your pelvic floor muscles are so that you can have a good discussion with them. As an example, your levator muscles are your shallowest muscles, your piriformis muscles are your deepest muscles. Now, when you go to physical therapists for the first time, their job is to study your body. So they're going to usually have you walk up and down a hallway. They want to see how you're walking. They're going to look at your legs. They're going to look at your belly. They're going to look at your back. They're looking for fundamental tension patterns. And then eventually they're going to do an internal exam. And let me get my model here. The most important part of this is the internal exam, because we need them to touch your muscles. And if they can touch a muscle and trigger pain, that is what I call your hallelujah moment. That's really, really exciting because it means they found it. They found it. Now, remember, last year we had a research study that found that 70% of men with testicular pain had an underlying hip abnormality. It was a bad hip. And so today, we really are taking a step back and we're looking at muscles and bones. Hey, Sierra, let's talk this week, okay? Because I shut the Zoom down. So why don't you call me on Tuesday or Wednesday and we can talk about it, okay? All right, so let's get back to that pelvic floor. So look, here is a typical pelvis, right? And I want you to notice that for the most part, the muscles are protected by bony structures, right? And so it's pretty hard to get to these muscles from the outside. The other thing I want you to notice is that the muscles are actually also very flat and they lay on top of bone, right? And they normally lift up and they start interfering with other things when they get super, super tight. So concept number one here is that you really can't do a proper evaluation unless we have a finger touching muscle, right? And it's important that the devil is in the details here. You need to take a little bit of time and write down your symptoms. And I want you to pay attention to the weird symptom that only happens every now and then. Like when you sit down, do you notice a fluttering? Like you're sitting on a cell phone on vibrate? Or do you ever have pain shooting down your leg? Or do you have pain that goes up your spinal cord? Or do you have fluttering in your feet? Like I was working with a patient who had pain shooting down her leg and she had foot pain. And she thought that was IC. That was not IC. That was pudendal neuralgia, that she had muscles, rock hard muscles, so tight. It took 2 weeks for the physical therapist to even be able to do an internal examination. She was locked down hard as a rock. She had what we call vaginismus. Now, the other thing to understand about the pelvic floor is that there are 3 layers. There's a shallow layer, and this is the shallow layer. This is your levator ani muscles. And what's important to understand about these muscles is that these are the only muscles in the human body that control really important functions for you, being able to pee or have a bowel movement. So these muscles have, for women, 3 holes in them. There's a urethra, there's a vagina, and then there's a rectum. But if this muscle is tight, what do you think is going to happen? It's going to be hard to pee. It's going to be hard to have a bowel movement, and it's going to be painful to have sex because all the muscles are so tight here. Then you've got some mid-level muscles right here, right? And then you've got some super deep muscles, like your piriformis muscle. If you have sciatica, then that means that your piriformis muscles are really, really tight and they're compressing nerves. So what they're going to do is they're just going to gently touch muscle. They're going to touch here, they're going to touch here, they're going to touch here. They're just going to touch muscles. And if they can touch a muscle and trigger your pain, hallelujah. Oh my God, what are you touching? That's it. Don't be afraid of the pain. The pain's exciting. If they can touch it and trigger that pain, woo, Betty, you found it. This is great. You found it. Now, what is it? So then the second thing that you've got to understand is that muscles, let me grab this book really quickly. So if you were to go back 100 years and look at IC studies that were published by doctors, they describe muscles so tight they resemble tight piano strings. And yet, because doctors play in their sandbox, even though the urologists were noting that these muscles were tight, they were never working with the muscles. They just stuck with whatever was going on in the bladder. And the thing you've really got to understand about the pelvis is that nothing operates in isolation. And you think about how crowded this is. So here's the pelvis. So let's go ahead and put in our structures here. Hold on. So I have now put on your shallow muscles. So the first thing we're going to do is we're going to put in, oh, darn it. Okay, I'm going to take that one off. We're going to put in a uterus. Oh, that might be backwards. There it is. Right? So now we've got a vagina and uterus and ovaries. We're going to put in the bladder, which basically goes right there. And that's why when we ask you where your pain is, if it's directly above your pubic bone, that's because that's where the bladder is. And then, of course, we have to put bowel in here too. So the bowel is in here too, also on the left side. And so look at how crowded this is. And then, of course, we've got muscles, we've got nerves, and we've got blood vessels. And it is wrong to think that things operate in isolation. They actually influence each other tremendously. I call it the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor? They're both involved. They are both involved. They cannot not both be involved. They are two interconnected. But one is normally driving the other. So for some of you, if your IC began after chemotherapy, so we know your bladder is being profoundly irritated by the drugs from the chemo, and your bladder's screaming, help me, help me, help me, and your muscles will get tight in a guarding reflex to protect your bladder. That's nature. You can't turn that off or on. That's automatic. And so our therapeutic priority for the chemotherapy patient is to calm and soothe the bladder. And we know as we calm and soothe the bladder, the muscles should relax. But that's the smaller group. The far bigger group, we think, are the patients whose symptoms began after a muscle problem. So let's say you're the guy who was sliding in his socks on a wood floor, and he fell at the top of the stairs. And he went butt first down the stairs. It's stunning how many people that happens to. I've worked with many patients that have done that. And so he took bang, 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 tailbone on a hard floor. 2 days later, frequency, urgency, pressure, pain. Where'd that come from? Calls the doctor. Doctor goes, must be infection or an STI. Throw him antibiotics. Didn't work. Go back to the doctor. Doctor goes, God, it must be prostatitis. Let's give you some prostate meds. They didn't work. Then the doctor said, okay, well, I hate to break it to you. I think you've got this incurable bladder disease called overactive bladder. Here's Elmeron. Here's a diet. I'll see you in 6 months. And, he's a good patient. You're a good patient. You believe them. And of course you modify your diet. Of course you take your Elmeron or whatever else. And it might be 3 months, 6 months, a year, 2 years, 5 years, 10 years later. The reality is you're still not better. Why? Because for the pelvic injury patient, Elmeron will never fix it because the fundamental problem is tight muscles restricting blood flow. Our therapeutic priority for this group of patients is to restore blood supply. We need to improve circulation in the area because those muscles are locked down so tight, they're squeezing the blood vessels. And so how do we do that? With physical therapy. We're going to do physical therapy to try to get these muscles to release and flatten and lay on top of the bone. And so when Dr. Payne wrote his 5 subtypes, one of the things he railed on was what a crime it was to tell patients this was incurable, because some of these subtypes are curable, especially the pelvic floor subtype. Physical therapy works beautifully in the vast majority of patients who have it. The challenge are for the patients whose muscles stay tight. Why do the muscles, you can have physical therapy, trigger point injections, whatever, you walk out of the clinic feeling good, but 2 days later, a week later, your muscles are tight again. Why? And that's the question that Dr. Jerome Weiss answered in his book, Breaking Through Chronic Pelvic Pain. And of course, for muscles that stay tight, we have to step back from the muscles and we have to look at the bones. We have to look at the bones. Is there a problem with bones? Is there a bad SI joint like I have? Is there a bad hip? Is there a bad knee? Or is there a bad foot? And what he found in his clinic, he called it unraveling layers or revealing layers, or like you're revealing layers on an onion. That last final layer that was causing the great majority of the muscle tension was the feet. And how was that patient walking? Did they have one leg longer than the other? Did they have a bad knee, a bad hip? Were they pigeon-toed? Were they duck-footed? Did they have an ankle that rolled in? And that when the feet were fixed, the pelvic floor muscles finally became normal again. And so having that pelvic floor physical therapy first appointment is critical. We want them to look at your muscles and touch the muscles and look for tension patterns. And if your muscles stay tight over a long period of time, you're always going to ask ask the physical therapist, do you see anything wrong with my bones that would be causing all this muscle tension? Is it a bad SI? Is it a bad hip? Is there something else going on? Right? Revealing layers. Karen says, is it required to have pelvic floor physical therapy after spinal surgery to prevent pelvic or bladder issues? Oh, I think the proof is in your muscle tone. I mean, if you come out of that surgery and let's just say you're 6 weeks post-surgery, 2 months post-surgery, I mean, it depends, spinal surgery can be challenging because sometimes they do it from the back and then 2 weeks later they go in from the front. And they anchor your spine in 2 different ways. And that is a beast of a surgery to recover from. But I think you're going to have to look at your muscle tension. And if it's difficult to urinate, if you're feeling like you're peeing through a needle, if you're retaining a lot of urine, stuff like that, then physical therapy might be appropriate, but you're going to have to be surgically approved for it by your surgeon and or your doctors before you can do that. I have scoliosis. They wanted to fuse my spinal cord when I was in high school. I'm supposed to be an inch taller, an inch or an inch and a half taller, actually. I'm 5'9". I should have been 5'11", which explains why my ribs almost touch my hip bone, because that's where my curve is. That's why I'm straight up and down instead of having a narrower waist. All right, my friends, last call for questions. Last call for questions. We've been here for a little over 2 hours. All righty, so I'm going to give you your homework. Now, remember, if you would like to talk to me personally, you can just call the IC network. Mondays are my day off. Don't bother calling tomorrow. I got to have a day off. Tuesday through Friday, our phone number is on our Facebook page. Our phone number is on our website. I'm at the patient support line. And if you get me, great. I'd be more than happy to talk with you. If you want to make an appointment, making appointments is hard because our day is so dynamic. My policy is crying patients get first priority. So I generally only make appointments for patients who are coaching. Otherwise, you just have to call and try to catch me. And I also return phone calls very late into the night. So if you're on the East Coast, I could call you at 8:30 because I'm still working at 5:30 California time. So we have to adapt to each other's schedules. So anyway, and if you like our meetings, please make sure that you become a member where you can get our magazine, the IC Optimist, which we've done for 19 years now. This is written specifically for you. My goal in anything I do is to have you within 5 minutes find something that might be useful. And so this is a very, very good issue. We talk about pregnancy, we talk about migraines, and most importantly, we talk about malnutrition because some patients are so diet limited that they're almost facing malnutrition. And so registered dietitian Callie Gragier goes over the critical vitamins that we need and lists the foods that are bladder friendly for you to get that vitamin, as well as some of the early symptoms of vitamin deficiency, which is just so important. All right, so here's your homework. For 15 minutes a day, I need you to do something for your soul and for your spirit. I'm going to be going and sitting outside, as long as it's not too smoky. No fires right now. My go bags are packed. That's what I did all last weekend. All prayers welcome. For 15 minutes a day, I need you to do something for your noggin. I need you to read something. Come on over to our website, read a blog. Please you got to get your knowledge level up. The fabulous thing about this book is it's free on Kindle Unlimited. So, seriously, no excuses. It's freaking free. Read a chapter a day. You can do it. Or any of the other pages on our website. For 15 minutes a day, I need you to do your physical therapy and your relaxation. Over on our website, you'll find a whole bunch of free guided relaxations from Beaumont Health. Use them. If you're stressed, if you're tight, use them. They're wonderful. In fact, maybe that's how we should end our meeting. And for 15 minutes a day, I need you to do something for your noggin. I mean, I already did that. I need you to do something that will laugh. You need laughter in your life because laughter modulates pain. And so you have my permission to watch a funny movie. You have my permission to do TikTok, which I keep deleting off of my phone and my iPad. There's something about TikTok. It is hysterically funny, but like before you know it, 2 hours have passed. This is not good. But anyway, TikTok, YouTube, watching a funny movie, calling with a friend, and just living in the light, if you know what I mean. Living with a light heart. So let's see here. You know what? Let me just try something here real quick. Oh, also, I just really want to recommend, I don't know if you guys heard about Prince Harry and Oprah Winfrey collaborating on a new series called The Me You Cannot See. It's on Apple TV. It's produced by Oprah and Prince Harry. It is stunningly good. Lady Gaga is in it, but lots of normal, non-famous people are in it too. And one of the things they say is it's not what's wrong with you, it's what happened to you. And I think that, as they say, we all have things going on. We all have a past. We all have a history. And the influence on the history of our daily life and of our health is absolutely profound. And Prince Harry, is just stunningly blunt about what life was like for him as a child, how he became extremely afraid of photographers and flashing lights and cameras, because every time he walked out of his house as a 3-year-old and a 4-year-old, they were bombarded. And that's his trigger now. He said the hardest thing for him right now is to fly into London because he has PTSD and flashbacks, especially since his mom died. And so the stories are very intimate. They're very, very wonderful and very, very inspiring. So The Me You Cannot See is on Apple TV, and it's wonderful. Let me just see if we can do one thing here. I want to. So we have. This is free guided imagery for pelvic pain, IC and pelvic pain, done by Beaumont Hospital, and they did research with this, and the research proved the patient's symptoms improved. In some cases dramatically. So let's just out of curiosity. It's pre-recorded, Sierra. There's no date time. You just go onto Apple TV and look it up. Let me just see if this is loud enough for me to play this. Here, hold on. Whoa, it's a 3-second recording. What? Hold on.
Welcome to this Beaumont Center for Mindfulness guided practice. I'm Dr. Ruth Lerman. So glad to be with you today to practice together.
How was that? Was that muffled? Could you hear that or not? I don't think the quality was good enough for us to repeat it. So anyway, go to icnetwork.org, go to guided relaxation, and you can go through about 10 different guided relaxations that are fabulous, created specifically for IC patients and pelvic pain patients. Norman said he got his shots, 0 problems. Awesome. All right. Any last questions? Otherwise, we'll cut it here and I'll go sit out in the sun and relax a little bit. All right, Facebook. All right, YouTube. Love you all. You are not alone. Please remember, this is not your fault. You have done nothing wrong. I don't want you carrying any shame or any blame. I will see you again next weekend, but I am doing drop-in meetings now on Facebook on Thursdays, and I'm going to be doing more. So anyway, I'll see you later. Be well. All right.